Hello everybody, my name is Dr. Shraddha Sureka. I am a cataract, LASIK and cornea transplant surgeon based in Mumbai, India. And today I'll speak to you about cataract. So what is cataract? So cataract, I would say, is something like whitening of your hair. You know that with age your hair is going to get white. In the same way, your eyes also have a lens, and this lens is going to become grey from its original transparent nature. So this is the lens and it is placed inside the eye at this point. It is essentially transparent, so a lot of rays of light can go inside the eye and you have great vision. But with age, this lens becomes translucent or greyish like a fog and you have decreased vision. So why does cataract happen? Cataract happens because of age. It's a degenerative process and everybody is going to get cataract at some point in their lives. Very rarely we may have some children who get it. Say a patient has got it in the eye, they might get it. Some patients may be on medications, or a patient may be a diabetic, so he may get cataract earlier. Or say a patient with a very high number, they may get cataract earlier. So how do you know that you have cataract? So cataract essentially reduces the amount of light which goes inside the eye. So you will have decreased vision, and the vision is not correctable by glasses. So when you wear your glasses, you will feel you are not able to see things in a way you were able to see say 3 to 6 months back. You will also notice that there might be frequent change in the glasses. Some people may find it difficult to see in sunlight. Some people may find it that during night, the lights coming are quite spread. Some people may see double things, and that's when you know that there's a problem and you need to go to an eye doctor. Your eye doctor can examine and tell you whether you have cataract or no. Now, how can you manage the cataract? Are there any eye drops available? Well, there are many eye drops available in the market, but none of them actually work. But don't worry, it's not like you have to go and get your cataract operated as soon as you get cataract. So, cataract may be there in a lot of people for years together. How do you decide? So, when you think your activities of daily living, say you like to read on the mobile or work on the computer, those are affected because of your vision, that's when you need to get your cataract surgery done. For some people, it may be say driving at night is affected. For some people, they may feel colors are not very clear. So some people with very advanced cataract are also very comfortable. So you decide when you want to do your cataract surgery. Of course, in rare circumstances, the doctor may tell you that okay, now you cannot wait and it's a semi-emergency that you get your cataract surgery done early. Now when you get your cataract surgery done, it's a quick laser procedure. We don't give any injections. Most of the patients are numbed by putting eye drops in the eye. We don't require any stitches. We don't require any bandages to be put in the eye. And it's an absolutely painless procedure. The patient is allowed to go home in a few hours and there's no one-day hospitalization required. So cataract surgery is done currently by a laser which is known as phacoemulsification or phaco, and that's very advanced technology to get rid of a cataract. So what we do is we use a phaco machine, it's like a pen which we hold in our hand, and only the tip of this pen goes inside the eye and it goes up to the lens area. It kind of acts like a mixer wherein a solid cataract is churned into a liquid, and by suction it sucks away that liquid. So you have a clear area or a clear bag there. In that we would insert a lens, and the transparent cataract, which had now become opaque or translucent, is replaced by a lens inside this bag. So what are the types of lenses which are available? Now there are multiple lenses available in the market. Let's look at a few of them. So if I have to just kind of classify lenses, I'll classify it into monofocal and multifocal. Now, when you put a monofocal lens in the eye, you would expect that your vision for distance will be quite clear. You may be able to drive without glasses, watch TV without glasses. But when you read or say work on the computer, you require glasses. Now, we have advanced versions of monofocal lenses which are known as depth of focus lenses. Currently, depth of focus lenses have been created in such an advanced manner that they don't have any disadvantages over monofocal lenses, and they give you extra intermediate distance vision, that is working on the computer say for a lady working in the kitchen will be quite easy. But for reading and some activities, you may require glasses. Currently, our preference is to go for depth of focus lenses. Now, the next lens is a multifocal lens. So, in multifocal lens, we estimate that the patient would be able to drive without glasses, will be able to see the computer, that is intermediate distance is good without glasses, and the patient will be able to read without glasses. For very fine activities, the patient may require some amount of glasses. So multifocal lenses are fantastic by theory, but they do have a small problem. Say you drive at night or you go outside in a function at night, the lights which are there, they may appear to be spread, and that can disturb patients say who are driving at night. So we avoid it in people who want to be independent and be night drivers. We may prefer it in say housewives or semi-retired people who don't wish to drive at night. Also, if you do have a problem in the eye, say a retina issue because of age, because of diabetes, then we would avoid this lens in the eye. Now the next type of lens is a toric lens. For that we need to understand that this is the cornea or the front portion of the eye which is transparent. Now if the cornea has a different curvature in one axis and a different curvature in the other axis, the patient will have a cylinder. So if the patient has a cylinder, we can correct that cylinder also when we correct your cataract. So we incorporate a toric component in your lens. That way your cylinder amount will reduce, your dependence on glasses will reduce even further. So you will have to go to the doctor and the doctor will tell you whether you need an extra toric component in your cataract surgery lens, be it monofocal or multifocal. So cataract surgery today is a very safe, very comfortable surgery. The good thing is you can decide when you want it to be done. You can plan it out, say at a time where your social commitments are low. You don't have, say, exams in the house, an important function in the house. And when you and your family members are relatively free, you can get cataract surgery done. Thank you, and if you have any comments or any queries, please let me know in the comment section. Me or my team will get back to you. Thank you.